Welcome everyone at the Telehealth in Crisis webinar organized by Health Tech Without Borders and powered by UBIQ Webinars. My name is Latka Roris and I'm happy to see here so many people from different countries and different time zones who would like to learn more about telehealth for disaster response and humanitarian crisis. We will have today 4 presentations by 4 representatives of Health Tech Without Borders, but before we will start, I would like to go through the housekeeping rules. So please ask questions to the speakers in the Q&A box in the Zoom control panel or also in the chat. I would like to ask everyone to be interactive, to be polite, and to respect the others. And also, please do not express your political views during this webinar. So now it's my pleasure to introduce the first speaker and also the founder of Health Tech Without Borders, Hicham Naim, who is also founder of Curated Health and VP Head of Strategy and Transformation in Takeda. The motto of Hicham is better health for people, brighter future for the world. Thank you very much, Hicham, for being here today. And now we are looking forward to your presentation.
Thank you so much, Vladka, for inviting us and giving us the opportunity and the stage to talk about Health Tech Without Borders. Can you hear me well?
Yes, we can hear you.
Very good. Yes, so I'm founder, but I like to say I'm a co-founder of Health Tech Without Borders because it's not only me, it's Marianna, it's Sharon, it's other people like Olga, Eva, and many, many other people. So again, thank you for giving us the stage to share our purpose and what we have done and what we would like to do in the future. I will try to move the slide if it works. Here we go. So I would like to give you a context about why we have created Health Tech Without Borders. And I want you to imagine a situation where your community is hit by a sudden humanitarian emergency and you find yourself suddenly cut from a basic healthcare services, from your hospital and clinic are under pressure. You find yourself disconnected from healthcare professionals, medical institution, doctors, and other life-saving services. This is actually the reality for many, many people in crisis around the world today, whether it's in Ukraine. We have seen that recently in Pakistan, and Maria's story also and said about that is what is happening currently in Turkey. And try to move this. And actually, this is where Health Tech Without Borders comes in when we start thinking about it, we say what we want to do is to create a global non-profit organization that is dedicated actually to mitigate healthcare crisis, but by leveraging digital and technology and to provide immediate access to healthcare to people that are in need. And I will talk more about why we focus on digital tools and technology. And the second thing that we wanted to do, why we exist, is we want to connect actually companies offering digital tools and technology with experts, whether they're medical expert, psychological expert, but also expert in humanitarian aid, and think together about how we can provide innovative solutions to humanitarian aid. And our story actually started exactly a year ago. I still remember when my friend Marianna reached out and say, right after the war started in Ukraine, and say, we have to do something. And I still remember our very, very first post on LinkedIn, where it was a black box with a white font, and we wrote a very simple message. We call for help. We're looking for telehealth company and clinicians and volunteers who can help us. And the response was just overwhelming. I still remember first week, 40 plus organizations reached out, telehealth organization. We had the first week, 80 plus doctors who say we're willing to help, and 20 plus volunteers who say we're not doctors, we're not nurses, but also we want to help. And I have goosebumps back to when I think about this first day. And unfortunately, what started, which was the aggression in Ukraine, is still here. And it's very sad to see that today, not only we're talking about thousands, but also millions of people, some people that were forced to leave their home to seek safety and medical assistance. So what we have done the very first month, we start organizing this consortium of universities, clinician, psycholog, telehealth provider, and other technology provider to basically kick off a telehealth support. And I'm still remembering the very first time Marianna and the team went live with the very first patient in one of our in one of the platforms with our partner Doctor Online. And since then, basically, our work and projects start mushrooming, and we start doing many different things from telehealth services, but other type of intervention. And we decided as a team that, to have focus and have impact, we have to put them together. And that's why we put them together under 3 strategic pillars. And hopefully we'll hear more from Marianna, from Eva, and from Olga about some of those examples of projects that are sitting under each pillar. So the very first pillar actually, it's the telehealth services. And the aim of telehealth service, as you might guess, it's basically provide remote consultation to patients and to people in crisis. Why? Because it's almost twofold. There are a lot of doctors that are willing to help, but they don't have necessarily the freedom or the flexibility to leave the comfort of their home office and go to area of crisis to support. And by providing them a channel like a telehealth services, they can do that without taking the risk or without leaving basically their home. The second part of our focus today is the virtual education. You will see some examples. It's basically here to empower healthcare professionals, provide them with additional knowledge that can help them, basically empower them and help them better serve the patient. But also, you will see an example from Eva. It's more than just education. It's a way also for us to provide them support, mental support, because those healers, sometimes they need to have support. And we have seen that since COVID, but also with the war, is that those healthcare professionals, sometimes they have high probability of having burnout. And the last one is the ecosystem building. I mean, we recognize that no one alone can basically provide sustainable services. And by building this ecosystem, it's basically we're sharing the load, the knowledge, but also we're building something that can be more sustainable over time. And after a year, I think we can take pride of our accomplishment. Personally, I would have never imagined when we did the first post that today, Marianna, myself, Olga, and Eva could be in front of you and talking about some of our achievement. It was, I remember when we started that, we said maybe it's two months, 3 months, and the war will be over. It's really sad to see it's still here, that people are still suffering. But on the other hand, I think we can take pride of some of those accomplishments. And, we have today mobilized more than 800 volunteers across 20 countries. We, thanks to our partners in Ukraine and outside, we have reached more than 2,000 clinicians. And thanks to our partnership and thanks a lot to Doctor Online, we have conducted more than 100,000 consultations today. And you will see an example from Eva. We provided more than 300 hours of mental support to healthcare professionals. And if you look to, when we start looking at the spectrum of telehealth consultation, actually it covers the whole spectrum of medical care. And again, those accomplishments are beyond mere statistics. It's not about how many people we have helped, but what impact we have done and what impact we can do more. I mean, by providing online consultation, what we need to look at is that we have extended healthcare access to people who might not have otherwise. By providing education program, we're basically building capacity. We're supporting healthcare professionals, but also we are enabling and building a capacity that can afterward be there once we leave. And the last one, it's by developing this ecosystem. The idea is to make something that is sustainable. And I will talk more about that because today, that's my personal point of view. The humanitarian aid today, it's still stuck in the 20th century. And there's no way with the trend that we see that we'll have more crises, whether they're linked to climate or war or other disaster. There's no way with the traditional approach to humanitarian aid we can serve in an efficient and fast way people that have the need for access to care. The last thing, talking about the demand, since we have started, while we continue supporting Ukraine, we are today receiving calls from Mexico, Iraq, Pakistan, Philippines, Sierra Leone, Nigeria, and just recently Turkey. So it shows that there is a need. And it shows also there's a need also to rethink the way we provide humanitarian aid beyond the traditional way of moving people. I think it's still important to have people on the ground, but also it's important to reimagine how data, digital and technology could help maximize and augment that impact. And again, this is just the beginning, and there's so much we can do. And if there is one thing I want you to take back home is that we need your help, not only Health Tech Without Borders, but all the NGOs that today are working to make a difference. So if you are someone who is passionate about leveraging technology to enhance healthcare access, equity, or help people in crisis, join our team. And if you can't, and if you have resources, think about making donation, whether it's to Health Tech Without Borders or any other NGO that you believe is making impact. And if you cannot, you can still help us spread the word and talk about our mission, and help us basically build awareness about the necessity to help people in need, but also think about how we can leverage data, digital and technology to make that impact. And again, I want to close this presentation by thanking you, and also especially thanking people who believed on us. I mean, I remember Marianna and myself were just two people, and people came, and the first people to thank are volunteer who basically didn't spare any time and any effort to make that happen, whether they are doctors and other clinicians, volunteers that are working, behind the curtain, you don't see them. Thanking also the companies who provided pro bono services like Doctor Online or other companies who provided basically their own platform. And also thank other people that basically help us connect with companies and make a difference. And again, thank you, and thank you for listening to us. And I'm open to any other question you might want to ask me, or to ask Olga or Marianna or Eva.
Yes, thank you very much, Hicham, for this introduction and for information about Health Tech Without Borders. So now we have some space for questions. If you have anything, you can write it to the chat or to the Q&A box. But I would like to ask you, as you mentioned, that you are working and acting actually in different countries. So I would be interested to know, how long does it take to, start to be active, to work in a new country where some new disaster happens, such as, for example, now in Turkey with this earthquake. So how long, does it take for the organization?
I will have an answer, and I think I will also ask Marianna to jump in. I think it depends on the use case. Like if you are providing virtual education because you want to provide some important information to healthcare providers there, I think it will be relatively fast. But if you want to provide something like telehealth services or more advanced support, I think it will take longer. But on average, for like virtual education, correct me if I'm wrong, Marianna, this is relatively fast. And there's one information is that providing telehealth services is faster than providing the traditional support. Marianna?
Hello, everyone. Thank you for having us today. So, Vladka, if you don't mind, may I ask you also, Olga and Eva, to switch on their cameras just for audience to see the entire team from Health Tech Without Borders, just to see like all of us that we are here for you today to answer your questions and to provide the information to share our experience. And yes, I would say that the assessment of the country of the potential implementation of different types of actions, including the telehealth, mental health, or educational programs, this is the first step which we make usually. And it's depends a lot of the digital literacy, health literacy of population. It's all about the languages. Let's start from this point. And this is what we learned on the example of Ukraine. And, we have like 80% of our volunteers who are from the former Soviet Union. So people familiar with the healthcare system, they also know other Ukrainian and Russian languages. So that was kind of one of the first requirements we had during our call to action. But it's a lot about languages. So there are countries where it's much easier to go. So like, I don't know, Pakistan or India, despite they also have like local languages, but anyway, so Yeah, and local infrastructure, local healthcare system. So all these points we really think very carefully about when we make the assessment of and making the final decision for go no go, let's say.
Sure. Yes, so I believe that you will share us much more in details about the actions of Health Tech Without Borders. So perhaps we can move on to your presentation, and I will quickly also give an introduction of Marianna, because I cannot see any questions now. So Marianna is digital health expert with more than 20 years of experience, and she is also founder of the Health Tech Without Borders. Marianna is experienced in emergency deployments for different types of disasters, and now she will give us more introduction, and she will tell more about the activities of Health Tech Without Borders. So thank you, Marianna, and we are looking forward to your presentation.
Thank you so much again for having us and giving us floor, and thank you for your time today. So let's move to the telehealth. So telehealth for disaster response. So let's start from this, big image, which I usually also share with students, because now we started also tele-disaster courses for different universities, including Chitkara University in India. So this is the beauty of implementing telehealth for different healthcare systems. And here you can see that, for example, we can think about implementing telemedicine platforms based on some big hospital, which usually also has some EHR, electronic health record system, which of course telehealth sometimes can be a functionality of EHR, or telehealth platform can have their functions of EHR, so they can nicely live together. But usually we have different interfaces for patients and clinicians, and also a big admin part, just to be sure that every functionality works well, that the workflow is going smoothly. Basement of telehealth, of course, it is a communication channel. And usually we discuss something like audio and video, but the example of Ukraine shows that texting is actually quite important functionality, and we shouldn't forget about it. So electronic scheduling is really giving the flexibility on both sides of clinicians and patients, just to work more efficient with the timing. And for different healthcare system, it can be really important to have a good, strong billing system and online payment. So here you can see that actually this hospital can be connected with different remote clinics or rehabilitation centers or centers of disease and control preventions. And of course, with some remote clinicians and patients, and the entire workflow and data flow can nicely, organized, and also with some functionality of reporting to insurance companies and to the Ministry of Health. And if we think about the Ukraine telehealth relief, of course, we followed the main goal. We wanted to help a lot to Ukrainian healthcare system to cope with this difficulty, especially in the first days of the war, where it was, a very messy situation, and the access to the medical care was really difficult in some locations. And we, from the very beginning, put a lot of effort to start to work as a psychological support, not only for patients, but also for the clinical colleagues. So as Hicham mentioned, we achieved quite, big numbers of telehealth consultations within Ukraine. We're also working in other locations. And I may say that now we can cover almost the entire spectrum of medical care with the collaboration with the different partners and different NGOs. The big achievement is the network of volunteers, the network of organizations. And here the response, again, from global community of clinicians, medical professionals, psychologists was really, really big. So let me show you and explain a bit in details the timeline of the implementation for Ukraine. As Hicham said, we made call to action. You can see this blue line almost on the second day of the war. It was mainly on the social media, but it was quite precise message to the community. So to whom we really want to kind of invite on our side to make a group and to organize the response. And we received during almost 2 days, 240 applications from clinicians. It was really overwhelming with the different telehealth solutions and companies who wanted to participate in this move. And you can see that in parallel, we did different activities. On one side, if to split them, we made vetting process and onboarding for clinicians. And from the other side, it was a huge work of implementing telehealth solutions and adjusting them to the needs of Ukrainian healthcare system. So I would like also to mention that our key partner in Ukraine is the platform Doctor Online. It's really interesting telehealth solution with many bright ideas with functionality. But also in the middle, let's say in May, we received a huge help from Doximity, which is American telehealth platform, and they provided us with the vetted clinicians from their side. So we had the second big pool, a group of vetted clinicians, which we managed to onboard as well. So a few words about unique challenges. And if I would choose one, the main challenge, of course, it was time pressure. And this challenge we put on ourselves by ourselves. So we wanted to implement telehealth as fast as possible because we received so many applications from volunteers. So we felt the deep responsibility to onboard these people on telehealth solutions and to give them opportunity to work and to help patients. Yeah, another thing is that, of course, the perfect setup is if the telehealth platforms somehow are from the local country, as we have the nice example of Doctor Online, because they had quite good coverage inside Ukraine already. So, and the help of the local organizations, including NGOs, and of course, the government bodies like the Ministry of Health is really helpful. And from the very beginning, we wanted to be really compliant and meet all requirements like from HIPAA side or GDPR side from European Union to really implement the telehealth solution and not using some like a WhatsApp functionality or Telegram or other channels. So the digital outreach, yeah, how to bring this information that telehealth exists, that patients can come, that they have enough clinicians. So here we also had a nice support from the Ukrainian parliament, which announced that in the list of telehealth platforms available for the population were two our partners, it's Doctor Online and Viveo Health. Security and safety. This is a very specific challenge, especially for this exact implementation. And really our partners did their best and doing their best to be resistant for the cyber attacks. We are quite lucky because we have many people from the, as I said, former Soviet Union countries, including Ukraine. So healthcare system of Ukraine was quite familiar for us. So we understood the local context. We understood the magnitude of language barrier. And we also know quite well the level of digital and health literacy. And in Ukraine, digital literacy is quite high. So the population, you know, is quite open to solutions like telehealth, and they use it quite, you know, often. So another thing is that we, of course, in time, started to be both us and our partners quite flexible to some new challenging needs. So you need to really fix some of the functionality or to add some additional functions. And for example, onboarding was one of the points which we fixed together with Doctor Online, because one thing when you onboard, let's say 10 or 20 people per day, but when you onboard 250 clinicians once, like in a moment, this is really challenging task. So here I would like to show you some, let's say, basic requirements. Nowadays we are very lucky because the majority of solutions are really focused on the telehealth as the main functionality. Usually they meet all these requirements, but anyway, it's good to have it. We usually use not only the list, but we use like more complex things like in matrix, where we have the priority between the requirements, weights, and multiplying these things just to make the proper assessment of different telehealth solutions or other solutions from digital health domain. So you can see it here. We also wrote the big article for New England Journal of Medicine, where you can really read in details all the steps which we made during the implementation for Ukraine. So onboarding clinical volunteers, one of the big challenge, as I told you. When you do this for hundreds of people simultaneously, it's really important to have detailed text and video instructions, to have 27 service support and technical support. And another point, that implementing telehealth for war zones or the zones of the crisis requires the training how to work with patients from these territories. So the patients with the mental health issues, and thanks to Yeshiva University from the very beginning, we made these courses. They were available for our volunteers. The last point Eva will share with in her presentation in details. So a few key takeaways from our experience, that Healthcare Without Borders, actually we demonstrate the ability to deploy really fast the emergency telehealth solutions, even in the wartime conditions. As we said, the precise and articulated call to action can attract good response from the global community of volunteers, including tech companies, including academia, including medical professionals, psychologists. And really collaborating and having a big network, this is one of the key components. So as I said, there are standard requirements. There are also unique and specific requirements for disaster implementation. Now we are looking towards the simplicity, because usually during the disaster response, if you have like fresh new volunteers, if you have another location, it should be really easy process how to onboard both clinician and patients, and how to start really quickly. So usually we are looking towards the minimum but mandatory functionality, I would call it this way. So, and again, about the deployment and onboarding, if you think about this, and if you structure this approach and make it very, very logical, it will be much more efficient, and you will save tons of time, both on your side, on the side of volunteers, on the side of your partners. And as I said, we make always the assessment of the country of deployment, which is really critical, because sometimes, for example, you can have from 10 to 15 local languages. You can have a very low digital and health literacy in population. So these are really important factors which can, from one side, bring success to your fast deployment, from the other side, can be critical and bring a lot of risks. And let me show you, this is pretty complicated slide, let's say. This is how we build digital ecosystem within the Healthcare Without Borders. And dark blue pillars are main programs which we focus on. So we implemented telehealth. We also implemented the concept of virtual hospital. We pay a lot of attention to grow education and the health literacy pillar. And the mental health is also a big part. But on the left side, you can see that we want to structure our approach while implementing different digital health technologies. And here, usually I use the Stanford approach, where you can see the different types of domains of digital health, starting from new clinical care models, moving to health IT infrastructure and data management, then different types of algorithms, including AI and machine learning, wearable and medical devices, and also mobile and web applications. And here, different types of digital health solutions on the left side, and on the right side, a different type of medical specialties, nurses, and different patient groups, because I think that you cannot implement everything for everybody. So we should really be focused on and put some priorities here for different locations and for different needs. So, and the green and yellow and red lines, this is some different stages of our implementation of different types of solutions. So we are also looking forward for the next big product, which we will launch together with Microsoft. This is a chatbot for post-medical aid. Another big piece is Health Tech Without Borders Academy, which we successfully launched. And now we have our first course for the students of Chitkara University. And we wanted to record the first-hand experience from the leaders and experts, not only from tech companies, but also from academia and, of course, medical professionals. And now we are working with the big network of our partners, including the Massachusetts General Hospital, Stanford and Harvard Medical Schools, but also our partners like Shiver and Cut Medical Schools, and Microsoft VC and Butterfly Network. So I will leave you 2 links for recent articles about implementation. Especially, I would like to pay your attention to the first one. And of course, we have Health Tech Without Borders Academy YouTube channel, where all our recordings from all our experts are available for the wide audience. Thank you so much.
Thank you very much, Marianna, for this presentation, and that we'll learn more about Health Tech Without Borders. I can see there is a question from the audience. What % of the telehealth consults in Ukraine leverage video? Is it video or more audio consult?
So it was mainly texting. So, and you will, you can have an opportunity, if you will read this article, actually to see the all statistics also by the types of diseases and, you know, the different groups of patients. So it's absolutely kind of collected carefully. But yes, texting was the highest one.
Sure. And when it comes to raising the awareness about telehealth in the war zone, what do you see as the best way to raise this awareness, or what are you using? And if you could also share some experience with you know, creating some strong partnerships within the local community.
Yes, it depends also on the country and also on the type of disaster. And we should all, I think, understand quite well that sometimes, you know, the focus of the local community can be more on some, I'm just keeping in mind Turkey right now, honestly. So they have slightly different priorities. So you cannot, for example, push very hard towards the telehealth right now, because they just need to solve some more difficult issues they have. Yeah. With Ukraine, of course, we, like me and different members of the team, we have our own channel, our own network inside. And of course, we followed some, you know, advices, because there were some groups on social media. Social media was very active in Ukraine. So you can also use this channel.
Mm-hmm. Okay. You also mentioned the Doctor Online. So which other channels are you using, or which channels you can share?
So do you mean like a social, because Doctor Online, this is a telehealth platform, yeah? So
Yes,
they
yes,
also promote themselves? Yeah.
So
And,
other platforms or other also channels which you are using?
So in Ukraine right now, the main core partner is Doctor Online. Yeah.
I see. Okay, so we have also a video that Health Tech Without Borders would like to share with you. Also, in the meantime, dear participants, you can ask some questions in the Q&A or in the chat. So I will share the video in a second.
It has been 365 days and 365 nights. Sleepless nights. The sirens, the fear, the anxiety that breaks the night. Attacks that try but fail to break the strength of Ukraine. We know, no matter what, we need to keep going. We are Health Tech Without Borders, a non-profit organization that together with Doctor Online provide access to vital digital health resources day and night, helping to strengthen the mental and physical resilience of the brave people of Ukraine. We are here to help break the fear of the night. Найтемніший час перед світанком. It's always darkest before the dawn.
Very strong video. So also, as you could see, you can share this video. It will be for sure helpful for the Health Tech Without Borders. And now I would like to, if you don't have any more questions, I would like to introduce the next speaker, the third speaker, who is Eva Skinner-Regel. So I will share with you also her biography. So Eva is a clinical ethicist at the Massachusetts General Hospital in Boston. And she's passionate about humanitarian ethics, specifically areas of research in moral distress and moral injury in first responders working in disaster and war regions. And she will now speak more about the 3H program. So thank you very much, Eva, and please, you can start with your presentation.
Oh, thank you so much. And thank you everyone for taking the time to join this webinar. We are really appreciated and grateful for the opportunity to talk about our work at Health Tech Without Borders. And I will be talking about helping healers heal. This is the program that we frequently call 3H. I'll talk about the beginnings of the program, what are we doing now, and we are hopeful we will be able to take this program in the future. So helping healers heal, or 3H, takes its roots in the responses from the clinicians who either participated in the webinars that were developed by the Health Tech Without Borders that Marianna mentioned at the beginning of the war in Ukraine, the providers' sort of conversations and descriptions of how they feel that were obtained during the telehealth consultations, and from the general sense of urgency and need of supporting clinicians during the crisis in Ukraine. And that was sort of the first step in developing helping healers heal programs. So we sort of created, had the idea that the clinicians themselves need support, mental health support, giving everything that they have witnessed and everything that they've been dealing with themselves as people who were affected by the disaster in the war in Ukraine, and also as providers who were caring for people who were affected by the war in Ukraine. So the pilot, as we were starting sort of looking into how we can deliver that sort of a mental health support for the providers, we were hoping that the pilot would give us a better understanding of the acuity of needs of the providers and what a sort of a context and structure we can deliver the support. So the decision sort of was made to address the support needs of the mental health clinicians at first, because they were so actively seeking that support, but also because they were, during the webinars, it was clear the level sort of distress and the level of vicarious trauma that were experiencing by the providers, by mental health providers, as they were actively treating Ukrainian population that was experiencing psychological distress related to the war. And as Marianna said in her presentation, there was a great response from the clinicians who wanted to be volunteers, including those with a background in mental health, as well as an interest from the Ukrainian psychologists and psychotherapists to participate in the pilot. And from our pool of volunteers, we were looking for clinicians who had appropriate clinical and contextual knowledge. And again, as it was said earlier, one of the contextual knowledges was knowledge of the language. A lot of providers were either speaking Russian and Ukrainian. And we were looking for someone who was able to sort of meet those demands, because when it comes to mental health support, of course, the things can get lost in translation. So it was essential to find people who were able to speak the language. And I do want to say that the Ukrainian providers had the opportunity to choose the languages, Ukrainian or Russian, for very appropriate and obvious reasons. And there were some who understandably were preferring to speak Ukrainian, and there were some who were sort of saying that, well, we can speak either language. I think the other contextual feature that we were looking for, which was an important factor, is to sort of an understanding of the history of the relationship between two countries, and also Ukrainian understanding of Ukrainian intergenerational trauma of Soviet and post-Soviet times, including a long history of stigmatization and sort of coercive treatment of people with mental health issues, leading to this lack of trust in psychiatry and mental health treatments. And the reason why I'm mentioning this is because it was that sort of a experience, that intergenerational trauma, created an environment of limited awareness and limited understanding of the causes and treatments of mental health illness. So even before February 24th, the Ukrainian mental health clinicians faced significant challenges in providing and delivering care to all who needed it. And of course, now, coupled with everything that was going on in Ukraine, with all the psychological distress that was experienced by the Ukrainian population, the sense of being overwhelmed and the sense of needing a support was pretty essential for the Ukrainian providers. So our pilot started with the smaller numbers. We had 3 therapists, volunteers who were our mentors. And we had around 20, 25 volunteers participants, Ukrainian clinicians, who were interested in participating in the pilot. Not all of the Ukrainian providers sort of followed through when we reached out to them to assess their needs and assess their availability. Some of them were sort of probably left Ukraine, or somebody who were refugees. There were a lot of sense of being overwhelmed. But regardless, we started the pilot. And what we almost immediately realized is that there was this confirmed sense of a significant need and urgency in delivering direct mental health support. And by direct, I mean very time sensitive, very time appropriate mental health support. It was not done after the fact. It was done in the midst of the war, when mental health clinicians were treating the Ukrainian population. It was because of the Health Tech Without Borders. There was a possibility of doing that in real time. The pilot provided us with also the opportunity to sort of solidify, I guess, the structure and the main goal for the program. And sort of this is direct mental health support in times of humanitarian disaster. And this providing the opportunity for clinicians to address and process their own psychological and moral distress, so that they can continue to provide care without diminishing their own ability to care for themselves and others. I also would like to really remind everyone that the Ukrainian providers that were part of the program, the pilot program, and continue to be part of the Helping Healers Heal program, there also some of them were displaced and also had their traumatic experiences. They also had to leave their homes, or their homes were destroyed. They had family members who they were worried about, elderly parents, the family members who they have lost, and they also witnessed traumatic events. So as the war continued, they needed help and opportunity to process their own experiences, because the usual coping strategies and skills were not really working. So as Helping Healers Heal started to generate sort of some traction, we were getting sort of more and more involved, and kind of feeling where we're going is the right direction. And we began meeting with the Ukrainian participants. It became clear that the 3H program does have a lot to offer in terms of mental health support in real time. So this, in return, we sort of felt that by providing the support in real time, we also can positively impact the post-disaster recovery by preventing the burnout, by increasing the retention, sustainability, and resilience of clinicians working in post-disaster conditions as well. So currently, when it comes to the Ukraine, we have 5 volunteers who are our mentors, and 11 Ukrainian therapists who are participating in a program. I do have to say that one of those 5 volunteers is actually a Ukrainian therapist who was and is a participant, and who asked to be a volunteer with 3H, with Helping Healers Heal, because she experienced the benefits of what 3H has to offer, and was hoping to do the same things for her colleagues. The format of the sessions is individual. Originally, when we just started the pilot, we also offered the participants to choose either individual or group support setting. And even though some of them did say that they would like to have a group support, we end up with everyone opting out for an individual support setting. And the work is primarily directed at processing experiences, processing emotions that take place in therapists' lives and work, addressing issues of transference and countertransference, restoring emotional balance, providing clinicians, I'm sorry, with a better understanding of symptoms of psychological distress and moral distress, associated with work with traumatized civilian population. So the sessions also help providers to, I guess, to restore some sense of normalcy and kind of reorient themselves in the world. I did hear from some of the providers that it's very, sorry, it's very easy and very good to hear that there is life going on outside of Ukraine, that there is hope and there are opportunities. So that sense of normalcy is very important in times of disaster. We conducted, I'm sorry, we conducted over 300 hours of support sessions. And within those 300 hours, we think that around 1,200 patients that were helped indirectly through the prevention of early burnout and through the increase in resilience and sustainability of the mental health clinicians who are participants of the program. And one of the most crucial factors that we feel in preventing the burnout is sort of identifying and mitigating symptoms of moral distress in the very morally imperfect conditions of war. What we're also kind of see that the large scale, this type of large scale humanitarian disasters, especially wars, they change kind of people's perception of time, space, and self. So helping to recognize the roots of providers' experiences and recognize the factors that are leading to psychological distress and moral distress is essential, as it allows to kind of recreate that narrative of the clinicians' lives that was changed by the war. And providing support and opportunity for Ukrainian therapists to understand and to process their experiences of moral distress is important, because they are dealing with that kind of on a daily basis, working in conditions of war. We also are currently providing not only support for the mental health providers in Ukraine, but also for our volunteers, because we do recognize that the work that they do supporting the providers working in war conditions can take some toll on them as well. So it is important for us to make sure that our volunteers also get support that they needed. And the goal is to continue to provide the same level of support on either individual or group basis, to make sure that people who dedicate their time and their skill to volunteer at 3H have also the ability and space to process those their own feelings and their own emotions. We also know now that we developed a program that aims at kind of mitigating the symptoms of burnout and long-term psychological problems. It has the ability to deliver mental health support to clinicians working in disaster zones, and it be in a more targeted and kind of multifaceted way to prevent burnout, to increase resilience and sustainability, so that the providers are able to continue to heal others in the post-disaster recovery period as well. And what we know that is, of course, not surprising, that the timely mental health support in times of disaster is essential. And we saw this sort of on the our new initiative that we just begun last week, which is the mental health support for the clinicians in Turkey. And I do have to say that as the earthquake hit the Turkey and Syria, we reacted fairly fast. I mean, there was already that sense of that the mental health needs will need to be addressed and will need to be addressed very quickly. And we sort of had already a blueprint on how we could provide that support and what format and what issues and topics that we might have to address during mental health support. What we didn't have is that a contextual knowledge of some aspects of the approach to mental health and mental health support in Turkey. We obtained actually great help from one of the providers who gave us a brief overview of the situation. And as we conducted a brief assessment of needs based on our experience in Ukraine, literature on the psychological effects of large-scale humanitarian disaster, and the contextual knowledge that was obtained, we were able to record a video, which is both long and short versions of video, on trauma care, on exposure to trauma, on moral and psychological distress, on issues of burnout and sustainability. We also just initiated a support group with healthcare workers who are currently working in Turkey. The group comprises of 10, 12 healthcare providers of different specialties. And we were told that there is an interest for other providers to attend the group. So once again, we see very similar response. It is interesting because it supports the premise of helping healers heal, that the clinicians, the healthcare providers, need support, and that we at Health Tech Without Borders and Helping Healers Heal have that ability to deliver that support in a timely manner. So the disaster factors might differ in the clinical nature of providers' work in the different countries, but what is important is that the overreaching psychological and moral distress is quite similar. Clinicians who work in disaster zones, they recognize the need for support. They need to have that space and time to process their own experiences and their own emotions so they can go back and be pediatricians and psychotherapists and surgeons and provide the best care that they can deliver without being burned out, without feeling that they cannot go longer, or without trying to push through and then burning out. The Health Tech Without Borders in 3H can provide that support at the time when it is needed. And it can provide that support before the burnout, the stress leads to long-term psychological problems. And I probably would have to say that one of the great aspects of this program is that instead of being reactive to the stress and the effects of working in disaster areas, 3H is proactive in delivering much needed psychological support. And as far as the current crisis in Turkey, we are going to continue to run the group. Of course, we will add, if necessary, additional support groups. And as in any disaster response that is based on needs assessment, if it's needed, we are, of course, will add individual support sessions as well. So where we are heading with Helping Healers Heal. So we hope that we will be able to sort of generate that experience and knowledge that will help us next time when disaster strikes in any part of the world to respond faster and efficient. And by doing this and becoming better in how we can deliver much needed mental health support, we hope that we will be able to support clinicians throughout the most challenging times. They would be able to sustain their resilience for themselves. We hope that they will be able to sustain their resilience for their colleagues and people who they're healing. For example, the hope we are working towards that is that the Ukrainian therapists who participated in our program will become the source of strength and support for other Ukrainian therapists. It makes perfect clinical sense, of course, for the Ukrainian therapists to support their colleagues who share their contextual and experiential sort of experiences of war. Ukrainian therapists, the way how we view them and the way how we sort of feel of them is that they are soldiers. I mean, they are soldiers of the invisible front. They're fighting for each client at the time. It is a different type of battle that is going on the battlefield, but it is still quite fierce. And the work is needed now and will be needed even more in the future. So having therapists who are able to support their colleagues in recovery work is essential and is needed. And exactly the same we can say about the Turkey, where the providers will go on helping their peers, their families, their patients, because they would feel hopefully stronger, they would feel supported, because they would have this space and this opportunity to talk about who they are, where they are in times of disaster, what are they experiencing in time of disaster, and thus kind of creating this grounding presence for themselves and for others. And in the end, I do want to say that the disaster relief work is frequently also associated with support with medical care, food and shelter, and those are crucial for survival factors. But supporting those who provide care is as crucial in preventing long-term psychological problems, in sustaining providers who will be working in post-disaster recovery, in preventing the burnout, and preventing long-term psychological and maladaptive coping. So we plan to continue recruiting and supporting our volunteers who are generous in dedicating their time and skill. And I also want to say that disaster relief does not end with the end of war or at the end of the earthquake. People will continue to need care and will continue to need both medical and psychological care. So we will also continue participating in research and in our own development at Health Tech Without Borders as the program. We plan to continue to advocate for the importance of delivering psychological support in real time in time of crisis. And we will continue to develop programs that help care providers, be it a healthcare or, mental health or healthcare providers, to mitigate the burnout symptoms and psychological and moral distress, to ensure their sustainability and resilience so they can continue to help others heal. I have a few references. I will go back to the references, but if you would like to volunteer or to donate, please stay in touch, and thank you very much.
Thank you very much, Eva, for your presentation and telling us more about the 3H program. So if you have any questions, please write them to the Q&A box. And I would like to ask you, what are the requirements if somebody here is interested to be volunteer, to be a mentor? So what this person should do and what are the requirements for such volunteer?
We are looking for mental health professionals, absolutely. I think that it is very important to really being able to develop therapeutic relationship. I think the piece of therapeutic relationship, I cannot really overestimate it, because when we're talking about the providers working in disaster area, there's a particular level, and that's what we're talking about, the particular level of traumatization that is going, and being able to develop the relationships so people feel comfortable and trusting you, and being able to navigate some of the questions that they might have, for example, existential questions. Why does it happen? What is happening? Where am I? What is happening? Why do I feel this way? Being able to sort of lead the people in to better emotional space. There are certain requirements on I guess certain requirements and abilities to do this mental health support work. And the language skills, as Marianna was saying, the language usually is kind of a sticky point. We did have a lot of volunteers who were willing to help with Ukraine, but were not able to speak either Russian or Ukrainian. We did found different ways, of course, of volunteering, but direct support, that was not something that we could do. but I would say mental health, of course, that would be the biggest, at least for the program for us, piece of knowledge.
Sure, great. So if here is someone who will be interested to volunteer, please go to the website and you can contact them. And I would like to also know how long in average does every session take and how many sessions each therapist is taking within this program, or how does it work?
Usually it's an hour, but I do have to say, because I do meet with some of the therapists myself, and I mean, it is really not a counseling session. It is a support session. So, and I think that's the biggest difference. I mean, we are there to help. We are there to support. And if there is a need to speak a little bit longer and something is happening, like when in Ukraine, where there were times that are a little bit more tense right now and have been in a while, with bombings and with everything that has been sort of going on, some of the therapists were talking needed a little bit more time, and that is fine. I mean, this is what we are doing. We are hoping to help.
Okay, thank you very much, Eva, for this presentation. I can see there is a question from the audience, but I believe this Marianna would like to answer related to the cyberspace and in case the device is stolen or something happens. So
Yeah.
like...
So yes, I saw this question. Yes, Doctor Online has a double authentication process, like a two-factor authentication. I think you're familiar with this process, like using, I don't know, your bank account. This is kind of the basic thing. Yeah, and this is really interesting because we also had on the other side a few issues with this process, because we had many volunteers from United States and, you know, sending SMS through the United States mobile operators also had a bit of issues which we fixed on the way. So this process of setting up something for the global outreach is really interesting from the technical perspective, and thank you a lot for this question.
Okay, great. So now let's move to the last presentation and the last presenter, Olga Gersuni. She's public health scientist interested in research, education, and nursing, and she has a professional experience in these areas. She worked for many years as a medical assistant, a registered nurse, and a surgical assistant both in Netherlands and in Ukraine, and she will now speak more about nursing and education. So Olga, please share your presentation.
Thank you very much. Let me share my presentation. I think it's visible.
Yes, perfect.
Okay. Again, I'd like to thank you, all participants, to joining us today. And I know, well, this is the last part of the webinar, of the presentation, so I won't take too much time. But I'd like to discuss something else, something different, which is related to the educational supports. In this case, we're talking about one of the case studies, and this one is also in Ukraine. So what I would like to briefly discuss today is a little bit of history, really a few things. And then I'd like to talk about three things we have been working on. It's a container, it's a student support activities, and the professionalization activities. So the history of nursing education in Ukraine. And here I'd like to briefly say a few words about the Crimean War and the Sisters of Mercy there, and also the period of nursing education in Ukraine after World War I and II. So the Crimean War, I think why it was famous, especially for nursing, is because of the Florence Nightingale. And she became quite famous at that time. So the Crimean War in 1853, 1856, she developed a lot of things related to hygiene. But of course, the main aspect of her work was support of the wounded soldiers. So also at that time in Ukraine, well, although it was not officially called Ukraine at that time, but territorially it was. It was also the period when the nurses in Ukraine took a major part in the same war. So this Crimean War was also a big step for nursing education in Ukraine and nurses in Ukraine, because it was the start of the new era where nurses were involved as a medical professionals in the field. Also, the period after Second and the First World War was quite significant, because also due to the economical crisis and decline, also the educational aspects and the healthcare delivery declined enormously. So this one of the pictures of the graduates of the school obstetrician and nursing schools in 1948, so after the Second World War. And that's quite significant, because at that time many students started to build up their career and started to deliver healthcare in everywhere, basically. So let me tell you a few words about 3 of the initiatives we have in terms of supporting nursing education in Ukraine. So this is one of the quotes that we have received from the nursing students. And it says, basically, I will become my family's pride, graduate successfully and work with pleasure, hopes one student. And on the other hand, a fellow student fears not being able to accomplish anything in his or her future, and also to lose the friends. So that's quite significant and a bit alarming, because that's the time, it's this time, obviously, the time when students facing a lot of challenges, personal, but of course, professional challenges. So nurses, being the heart and the soul of every healthcare system, they are often underappreciated heroes. That was also the case during the COVID period, and of course now it's not different. And also another part of statistics is that about 90% of healthcare professionals are the nurses who basically provide healthcare. So this is a recent study from the European Federation of Nurse Association, and it basically shows in what conditions medical professionals in Ukraine, well, as this is Ukraine case study, are working. So this is one of the hospitals. And it seems like it is partially functioning, although they do not have means to work on the equipment or to do something with the building because it's been destroyed. But at least some of the facilities which are still there are probably functioning. So it is a challenge for healthcare system in every country which faces this kind of challenges, such as war. So young students who are about to start their career, they are afraid of starting their work life in such conditions. So that is why it is our duty and responsibility to support them if there is possibility to do so. So one of our initiatives was just to link those organizations, which you can see here listed, Geeks Without Frontiers and 50 Computer Aid, Core, and Simply Health, with one of the nursing schools in Ukraine. So they were able to receive a fully equipped container, which would support educational activities for young students. This is how the container looked like from the outside. And so you can see it's just a container, which has been fully equipped with tables, with chairs, and the laptops. So you can see those young students are able to study, able to work, able to work on their assignments or just do the homework. It doesn't really matter what they're doing, but in such conditions where we fear for electricity loss, also internet connection is not always stable. It is good to have some backup place where you can still safely study and still be able to finalize your education. So why we need to support students? Well, they are our future healthcare workforce. It's quite difficult, especially in such conditions as war, to think of that some other healthcare providers from abroad would be immediately going to Ukraine to provide healthcare. Of course, there are a lot of volunteers who are already doing so, and well, people won't be able to express their gratitude to them, but it's the country's perspective and the focus to establish strong and resilient healthcare workforce in Ukraine who would stay in Ukraine to carry out activities which are needed. So here we talk about the establishment of professional norms and values in very specific conditions. And as we all know, in such conditions they're facing, the fears and expectations are quite different. So the fear of failing the exam is probably a bit different in Ukraine than fear of failing the exam, for example, for a student in Netherlands, because the Ukrainian student would be still facing some other challenges. So if we talk about the students' supports, we know that for nurses especially, is the main task to take care of the patients. They are often the first face that patient would see and the voice the patient would hear. So they are a crucial partner in recovery. Students who are doing their nursing education are the youngest generation and the future of healthcare workforce, despite any uncertainty in every country, but especially in countries like Ukraine. In this situation, it is utmost necessary to support their working and their studying environments, because those young professionals, sometimes they're adolescents, they are facing challenges that's quite difficult to imagine, and probably not every adult would be able to cope with. So, as the work of healthcare professional is primarily working with the people, like patients, their families, their other significant people who are involved in the process, each individual is, of course, unique. And one of the roles of healthcare professional is the communication and interaction with the patients, where we have to acknowledge that skills such as self-awareness, self-regulation, social skills, empathy, and motivation are the crucial one. Given this situation that students are facing now, those skills, although they're very important, they still necessary, or they have to be supported. That is why we would like to continue support our students so they would be able to work on those skills which would be beneficial, of course, for the healthcare for the patients. That is why we are introduced a nursing survey. It's a mental health survey, which we asked young students to fill in. The survey was quite highly filled in. About 100 students filled it in and just share their thoughts, their fears and expectations with us. And I would like to share a few of them. So, for example, when we are asking what worries you the most right now, lots of the students would be saying that the situation of the country, because it's unknown what's going to happen in 5-10 minutes, air raids, when they read about the explosions, if their relatives live in those cities or villages, the probability that the new society will not accept me, that's something quite difficult, because we don't know and they don't know what kind of new society there will be. Fear of not being able to accomplish anything in the future, but also losing dear ones, friends or relatives. I am worried that I won't be able to do anything, or I'm worried about that what happened next and what else to expect in Ukraine. So such fears parts of their own professional challenges are important to consider. Another aspect, what we asked, were their hopes, and this is actually the bright sides of their perception. So many students are still positive about the future. For example, I will become my family's pride, graduate successfully, and work with a pleasure. I would be having a family on my own, and I would be able to maintain a great relationship with my family, to get a respectable profession, to be a happy person, just a happy person. That's also quite important to mention, because what does happiness mean right now for them, for those young students? Other people would be thinking about the achievements, aspiration to change their life in the future for the better, the promising bright future, and saying that, well, I am not a weak person, I can do anything it will take. And people also hope for an excellent level after graduation and a good employment, and just to have a normal job, which would be also well paid. So basically, those expectations could be relevant in any context, of course, not only in Ukraine, but especially for them right now, given those fears what they're facing. This one is weighted a lot. So when we would like to support students, we would like to do that both on the mental health side, but also on the professional side. We'd like to express our experience or discuss our experience, why higher education is essential for the students, and why is the dilemma of many opportunities and challenges has to be taken into account. So what would be the next steps in the professional life? That's because the students in Ukraine, especially who are doing the nursing education, they're mostly girls, so women. And for them, it's quite easy to leave the country. So, but not all of them left the country, luckily, fortunately. And that means that we would like to stimulate and support those who are still there, so they would be able to get the advantage and the motivation of their education, and still would be able to deliver healthcare where it's needed a lot. That is why some time ago we already started one of the courses with one of the institutes in Ukraine, and there we were talking. It was the introduction lecture about why higher education is important, and what would you be able to achieve after having the bachelor or master degree in nursing. And yeah, a lot of students took part in it, and right now we're planning sessions to continue this kind of education online, and probably also, once it's safer, also offline, but that one is still to come. So one of the sessions we had with the students, and we were talking, we had it in an interactive way where I was presenting the information about why the education is important for them still to carry out. And they were asking questions, what are the opportunities, what are the possibilities for them in the future after graduation. So there is a code for nurses in Ukraine, which states that the personality of nurse is an organic blend of high moral qualities, general education, and professional skills and competencies. Now, especially this organic blend, quite difficult to measure. Of course, the high moral qualities, the general education, it is also difficult to measure. But still, what does it make this blend organic? And I'd like you to watch this short video about the organic blends of those qualities.
Hello, I am Lisa and I am a future obstetrician. I study at Volyn Medical Institute. Today, Ukraine is facing difficult times in its history. It strives for freedom and peace more than anything else. This is a solidarity in this world, and there are good and kind people who has proved that humanity really exists. We are grateful for all our friends and partners for support and help. As a student, I and my group continue to studying, attending classes and singing during our red alert.
Ой, у лузі червона калина похилилася, щось наша славна Україна зажурилася, а ми тую червону калину підіймемо, а ми нашу славну Україну гей-гей розвеселимо.
Glory to all who fight for our freedom, independence and peaceful future. Glory to Ukraine. Slava Ukraini!
Героям слава!
Thank you very much for your attention and for being with us. And please stay in touch, get in touch with us if you would like to help or donate. I'm sure that you would be able to find us. Thank you again.
Thank you very much, Olga, for this inspiring presentation about education and nursing. So I would like to ask you, how do you see the new generation in Ukraine? Are they more perhaps motivated now to learn about nursing and to become a nurse or to be a healthcare professional?
Thank you very much for your question. There is a dilemma in there. So from one side, they are very motivated and inspired, but they need a little bit of help. They need this support from the outside to keep going with their education, because it's easier for them to leave the country than stay and study. So yes, on one hand, they are very motivated, and on the other hand, they need support to stay motivated.
Sure. Thank you very much. So our webinar is getting to its end. So I would like to thank to all the speakers and representative of Health Tech Without Borders. And I don't know if you would like to say something at the end, but if not, I would like to ask all our attendees to click on the website of the Health Tech Without Borders to become a volunteer or to donate. Because of course we need to help each other, and I believe that we need more people as we have here today as the speakers in this world to become a better world. So thank you very much for your attention, and I wish you a great rest of the day.
Thank you very much, and thank you for giving us floor and for this beautiful organization and everything. So we were very happy to present the results of our work, and we are looking forward for next challenges, and we'll be happy if you will join us or if you will share this information about us with your colleagues. Thank you so much and have a great week.
Thank you.
Thank you.
Thank you.